Hey folks, welcome to another episode of the Paindora Podcast. This is one of your hosts, Dr. Kevin, he who does not have the fancy name after him. And my co-host is Dr. Melissa Cady, aka the Challenge Doctor, who does have the fancy name after her title. Here for another episode. Dr. Cady, what is up today?
Well, there's so many things we can talk about. I'm still hovering here at the house and not doing any cases, until these elective things roll up. But, there's just topics that I think people throw out there that I hear on TV and social media. And one of them is arthritis. People throw that around left and right as if it always means that you are in pain, which maybe we could address. Does arthritis mean you have pain?
Well, do we want to do the short answer or the long answer, right? So because the short answer is no. Yeah, see you next week,
Yeah. People are probably wondering why. I could just take a swing at it. When it is that you want me to go first?
However you want to go.
Okay, you can elaborate on what I say. How about that? So in general, people, how do they come to know that they have arthritis? Well, there could be a clinical assessment. They could, based on your symptoms and how things present. But most of the time what happens is someone goes in, says, I have pain here, and your physician orders an x-ray and they show abnormalities, things that don't look typical or smooth, say like a knee joint. They might notice that the space is a lot more narrow, or they say it's bone on bone. So you've got to have, pain, but we know that's not true. So you want to elaborate on what we should assume when we see these things?
Yeah, well, like any sort of pain related topic, there's so much unpacking that you need to do, because most of the language that we have, like if you look at communication in general, there's a kind of a supposition that we have a common language and vocabulary before we start having a communication. And if you have that common language, now you have an ability to have a message. So the speaker and the audience, or the person-to-person communication, we can effectively bridge that. And when it comes to pain, our vocabulary is off, right? And the reason I'm kind of pulling this all into, I'm not trying to complicate it, but try to make the discussion make a little bit more sense, is you can't really talk about arthritis and pain without distinguishing what is arthritis and what is pain. And in that conversation, most people will talk about arthritis, but the pain part gets glossed over and people assume that it's just pain, and we know it, right? Because we've all experienced it. So because we've experienced, we absolutely understand what pain is. That becomes complicated, because then when you move into arthritis, we start talking about structures. And so arthritis themselves, there's different types of arthritis. Arthritis, it's sort of a misnomer in some ways. The itis means inflammation. The arth is referring to joint. So it means joint inflammation. But even in that doesn't, arthritis, there's some arthritis that doesn't have inflammation, where there's swelling and things like that. Mm-hmm. So if we go from the arthritis standpoint, there's osteoarthritis, which is really simply change in a bony joint, generally secondary to age in utility, right? So like a hinge on a door or a car being used, it's not brand new once it comes out of the factory. Does that mean it's broken or damaged? No, it means it's been used. But there are other types of arthritis, which are where the body starts attacking a joint, like rheumatoid arthritis, where now you have these your own immune system is recognizing something different. It says this should be part of the body, but it's not, and then it starts attacking. It's like having a bunch of soldiers that are not good soldiers in your town because they're bored, and now they're like breaking up the bars and harassing the citizens. So both of those are called arthritis, but they're very different in their clinical presentations. And the ones we were sort of leading into is, does arthritis lead to pain? Most people are talking about osteoarthritis, which again is that age-related change associated with the joint. That means you're not a baby anymore. And this idea that because you have wrinkles, or you are, again, you're not a baby, maybe you have less hair or something
gray
like
hair.
that, or gray hair, that causes the pain. And what you were leading into is this idea that people say they have knee pain, or I should say they have pain that they're experiencing, and they perceive it in their knee, and they go into the doctor's office and you do an x-ray, and then they say, your knee doesn't look like a 20-year-old's anymore. Your pain pus is oozing out of that joint, right? And so we get this skew, because if you're only looking at knees with an x-ray if someone comes in complaining about pain. So now you don't know what the normals are. And when they do the studies that look at the knees of the people who don't have pain, lo and behold, what they discover is there's a whole bunch of people around who don't have knees that are 20-year-olds, and they don't have any knee pain. So that then leads us into to say, well, how can that be? How could it be? And so that pulls us over again to the thing that we like to talk about, which is pain. What is pain then? And man, we went all over the place with that, I went all over the place, but really is coming down to is you can almost break down all of these discussions when it comes to pain conditions or specific subsets of labeled pain. All of those are going to come back to that foundational concept of being able to understand pain and what it means to hurt and why we hurt. Right. And until you have a firm foundation there, all that other stuff is never going to make sense predictably and consistently. So right. that was a long way to kind of talk about arthritis and not talk about arthritis in the same way.
No, I think it's what I find interesting is those that have been given that osteoarthritis diagnosis based on changes on the x-ray, if you really stop to think that you personally may have had days with no pain and then other days with pain, that makes you realize that, first of all, that x-ray didn't suddenly revert back to your 1-year-old self. It literally is the same or worse looking. I wouldn't call it worse because that makes it seem like it's a bad knee, which a lot of people say that word, which it's a knee that's gone through changes, that it's fluctuating in pain. So the point is that there's a sensory component. There are sensations, information from the knee that can be processed with additional information within the central nervous system, such as your thoughts and your emotions, if you just got in an argument. And what I find interesting, and this might be something to kind of finish on, is just these, this idea of nociception is this other word we use for information that's changing and the sensations that are added to this experience of pain. I think that I find it kind of fascinating that sometimes the sensations that are at the site that might be a big contributor to this experience of pain may be a result of the type of lifestyle or type of activities or lack of activity that can be creating this information or alarm at that, the whole alarm system is going off, maybe because there is increased sensations. But like me sitting down right now, if I kept sitting here for 7 hours without moving and shifting, I would have a huge alarm going on, most likely because of sensations and the lack of blood flow and all these things. So just because I'm sensing that my rear end is hurting doesn't mean I need to do something to the rear end. I may need to change the activity that I'm doing and how I'm doing it. So for me, sitting for long periods of time, my body doesn't like it, my back included. So for me, the way I address that is I don't inject it. I'm going to get up and move and maybe change my pattern every 30 minutes to an hour. And I don't have that pain happen, even though the sensations might be originating for the most part from there. And feel free to chime in and let me know what you think for the audience on how that should be interpreted.
Well, and that's there's always so many places we can go with all this stuff, because
I mean, knee pain the same way too, like how you approach this.
Well, but it comes down to that becomes one of the kind of the misconceptions when we're talking about pain. And I've had this in a number of different groups and programs that I've run, that where people misinterpret the sensation as the same thing as pain.
Mm-hmm.
And they'll say like this sensation is painful, but the sensation in itself, whatever the sensation is not the same thing as pain. I don't care. Whoever is, if there's anybody out there that said pain is a sensation, pain is not a sensation. A sensation in and of itself is a group of inputs that provides really a detection mechanism. And so so you can have, if I say burning, I feel burning. If you can't immediately link that to pain, then it isn't pain. And what I mean by that is you can have a burning sensation, but that could be a pleasurable sensation based on the other variables that are there. Mm-hmm. Like if you like hot sauce and there's a burning sensation in your mouth, that becomes, burning sensation in the mouth. I like the hot sauce. This is a pleasurable thing. I love feeling warmth. I like to have the sweat dripping down my face. So now we have sensation, plus we have attention. We have an appraisal element that tells us that this is actually a good thing. And then we have the meaning, which is, this is hot sauce and I like this, right? But someone else.
And I don't.
Well, there we do. So now we have the sensation, which is not pain, burning, but is you, and you accidentally bit something. And now your mouth is burning, and now your attention is brought to that burning sensation. So you're now investing more attention to it. Now you have your appraisal, which is like, well, this is threatening because I really don't like it. Because the meaning you have is this is a hot, spicy thing. And I don't know, you have bad memories associated with hot, spicy things. And the sweat's coming down, and it's like, oh my God, needs to stop. So now we have the same sensation, two different people, different aspects of what we would call the cognitive element, and different aspects of that emotion, that a meaning that we're ascribing to it. We have completely different experiences that are generated from that one sensation. And so so people are thinking, like you're moving through a program or whatever, and people will say, well, I want my pain to go away. And oftentimes what they're saying is, I want my sensation and my experience that I'm building off of it to go away. Well, some sensations are going to be there, and you don't ever want to get rid of sensations because they're telling you important information coming from your body. Right. So like what you were saying is, you are sitting for long periods of time and you don't like it. It's something that your body needs to be protected from for multiple different reasons. And so you may have those sensations coming up saying, oh, my back is doing this, or I'm getting tight or whatever. I need to get up and stand up. That sensation in and of itself may not be quote unquote painful because you understand it. You understand the meaning associated with it. You have a reframe where it's not this threat to you saying I'm broken and damaged. It's challenging you to say, maybe I need to stand up and stretch, right? So you have the same sensation, but you have a different context and you have a different meaning associated with it. In the same way, then, the more you understand pain, and this goes back to the kind of arthritis things, the more you can kind of take away that sensation element by itself and simply have a sensation and reconstruct the experience. So for myself, as we get older, like I around the age of 35 was when I really started noticing that if I had been exercise consistently, that if I did start exercising, there was a really new change in my body, meaning red flags were going bing, 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 bing. Hey, you haven't moved us for this long time. Are you sure you want to do this? You better pay attention to your back and your knee and your hips and everything else. And we would typically call that sore. And then sometimes if you're over aggressive and the older you get, the more of those sensory inputs going on, they're telling you you've changed your lazy state. Is this surely, something that you want to do? And you can be tremendously sore, but the more you understand pain, you may be tremendously sore throughout your body, but you may not have any sort of pain, meaning you step out of your bed and you feel it and you're like, oh man, I work those muscle groups hardcore. But the switch becomes, hey, you know what? Maybe I need to not work quite as hard as I did yesterday. Why else? Oh, maybe you had too long of a space, or maybe I didn't have enough space between my exercise. But ultimately, because you kind of know how there's inputs in there, you can be, again, you have all sorts of stuff coming from your body saying, pay attention. But if there's no meaning associated with it, or the meaning itself is, hey, I'm actually getting stronger because I'm exercising, you can't, I would never call that pain. Speaking, at least for me, and I've done that many times since the age of 35 now. So anyway, that's that it becomes very important of pulling apart the idea that sensation per se is pain. Sensation is just a sensation. It's the other stuff that we add to it that constructs pain.
Well, it's interesting. So I said that was the last one, but let me just mention like a personal experience, and you break it down if you think that it should be explained in a different way. But for me, I have, based on my MRI findings from years ago, which is probably even worse or more changes now,
or not,
or the not. Same. But I have severe degenerative disc disease in multiple levels, and nerve roots are touched, and all this stuff that makes most people get all worried. I go based on how I feel, and my interpretation. If I'm sitting for long periods of time, or if I do things a little too fast and hard, the way I see it at 46 is that I'm a little bit less resilient than I was in my 20s, and that I typically need to ease into activities just slightly slower than I used to. The sensations more rapidly increase now than they used to, or when they never did in the past. And so I find that especially the little joints, the zygapophyseal joints, or the little joints in the back, the facet joints, based on my imaging are, have had a lot of changes. I did gymnastics, I did, whatever the stressors of gravity and impacts, made changes to support me with my strong spine. I see it that way. However, the sensory input, if I extend myself really fast, really hard, it is uncomfortable. You could call it pain, but I know that I have to ease into that position a little bit slower so that it doesn't get, I don't have too much sensory input where I can't handle it. So I just know the pace at which I need to go to get there. It's not that I can't get there just because I learned from going there too fast in extension. I'm not just going to avoid it. It's just, I want to allow my body to be okay with it. And so I always just say that, if my back's bothering, my back's mad at me, which is probably not the right word to use, but I know that the inputs are a little bit too much, and I got to figure out what is it I'm doing, whether I'm in an argument or I got a heated discussion, or I'm going into something too fast. And I got to be mindful to keep the sensations from being too much for me to bear to create a painful experience. So to minimize and avoid pain, I still do the things I want to do. I just do it differently.
Yeah. And I think I would just reframe that a little bit. Instead of saying my back's mad at me, I say, what is my back trying to protect me from?
Right.
Because you already hit on it, right? So is it trying to protect me because I'm moving aggressively and it knows we don't do it? Because just like anything, if you're ever lifting weights, you're not going to lift 250 pounds from a deadlift on the first time. I mean, could you do it? It's probably not the best thing to do, right? And so in that situation, when you're overextending, now that sensory input of which now we're paying attention to, of which we have threat meaning associated with it, that pain is protecting you from something. From your back, though, what you said is, could it be movement? Could it be sitting too long? Could it be a social or environmental stress that is also is that what it's trying to protect us from? And I think that is the one that people, again, so that just reframe of understanding that we've talked about pain as protecting you from something, and then being able to recognize that outside of the sensation, there's all these other inputs that are coming on. So there are many different places it could be trying to protect you. And the longer it's been there, I mean, the easiest ways for we'll just call let's pretend the brain isn't incorporated, right? There's somehow everything is like pulled apart in like Cartesian model or whatever. And you're doing your stuff, but your subconscious is got the little alarm going, looking for threats. And you're not dealing with threats that it's seeing. Probably one of the easiest ways for it to get you is to, hey, you know what? When we flared this area in her back, she stopped and started really paying attention. So her husband's being a total jerk and she doesn't seem to be recognizing that. So let's hit the hardcore alarm, because she needs to address that right now. And boom, we're going to flare up her back. And now you have a social or relationship stressor that's the threat, but it has an old kind of, it has an alarm it knows works, right? Because when it's done it for other things in the past, you've stopped and you've reassessed and you've taken some time to actually start maybe pulling back and looking at what you need to do when there's a threat. And it's not a physical threat, but it's just interesting, because people kind of put this in the back of their mind. Well, why is it that my back flares I'm at work? But when I'm sitting, I'm sitting in my office and my back hurts so bad, but then I can sit on a boat and fish for 12 hours on a weekend and I'm fine. Well, it's not the sitting.
Yeah.
It's the issue. It's something else. But anyway.
Yeah, no, I think context is important. And, I thought it was good to show an example, although my husband is not a jerk.
No, your husband is not a jerk. He's a wonderful man.
we do speak our mind, and that's a positive thing. So but no, there is definitely some history to me getting my body gets my attention, and I think people have a hard time believing that the subconscious is such an important aspect to all of this. And that might be something that we can talk about in the future. But unless you have anything else to say, I'd say that this was a quick topic because it comes up quite frequently, and hopefully people found some value and in the idea that this is a commonly misunderstood topic about, does arthritis mean pain? And no, it doesn't mean you have pain, but there are changes that are found typically on imaging, but it's a very common diagnosis, and to give you hope that pain can change, and there are a lot of inputs that we talk about in multiple other episodes. If there's something else you'd like to hear about in the future for the Paindora podcast, please let us know in the comments. And I am Melissa Cady, the Challenge Doctor, with Dr. Kevin, also known as Dr. Kevin Cuccaro, and we look forward to seeing you next time.
Stay well, folks.